Thanks for joining. This is Live with Miami's Community News. We're privileged to have two people that really care about other people. And we have Flavia Llizo and Chris Moran. Chris is the Chief Nursing Officer at Jackson Behavioral Health Hospital. And Flavia is the Co-President and Chief Development Officer at Jackson Health Foundation. So first, let's talk about our emotional and mental health issues that are going on specifically because of the pandemic that has affected most of us. So tell us about that.
Yeah, it's so true. The pandemic has affected everyone. People have had losses, their jobs, loss of loved ones, financial problems, and really the World Health Organization and the CDC have both done studies and significant increases in anxiety and depression among people in our country right now.
It is, traumatic for, I think, just about everybody. And when we think as adults we can handle it, we handle it whatever way we're able to handle it, right? And we have some of us have more coping skills than others, but when we look at youngsters, it's this big. Some of them, it's been a huge part of their life. Go to school? No, don't go to school. Wear a mask? Don't wear a mask. Go to restaurant? No. Mom and dad don't have work. Food insecurities, right? Transportation is a little mixed up. What about jobs? So this affects the whole community. And throughout the country, it's over 600,000 people have died, right? Their fathers, mothers, sisters, brothers, uncles, support people. You have, unfortunately, a lot of children that have died from this. So I think the hospitals have been, and the therapists have been pretty busy.
They have.
Yes. So let's talk about, if we could, for a moment, the Jackson Foundation, your role in helping Jackson Memorial Hospital and the facilities that it handles. Tell us what you do with this.
Sure, absolutely. So the Jackson Health Foundation is the fundraising arm for the entire healthcare system. And I think most people think that, recognize Jackson for Jackson Memorial Hospital, but there's actually 7 hospitals within the healthcare system, community hospitals amongst them, as well as behavioral health being one of the facilities that's there. So our role is to really help support the programs and services that can't be supported through just the general operating revenue and the tax dollars that come to be for the healthcare system. So things like an initiative that we'll be talking about, the Mind Your Health event, are things that we can help support and bring the community closer together with Jackson Healthcare. So we're excited to be able to do that.
So in the past 10 years, the profile of Jackson Memorial Hospital has risen tremendously. I mean, it's really an honor to be in a town where there's been such an improvement with that. Now, one of the things we know about mental health is there's still a stigma associated with mental health, right? And I used to look at insurance policies, it would be like, it was way down at the bottom for mental health, right? And I have friends that are in the arena, and when they explain to me the differences in compensation compared to before, it's certainly better, but it's certainly down on the list. People proudly might say, I was out this weekend and I broke my arm playing football, but I don't remember the last time somebody said, my heart is broken, my mind is suffering, and I'm having a lot of grief. I don't really hear that. You might hear it, but the average people don't really want to share that. So let's talk about, if we could, the facility and what services that you provide and how people get to you.
Sure. So, I think one thing that came out of COVID that was kind of good is it raised the profile of mental health, and people are talking about it more than they were before. Jackson Behavioral Health Hospital, we have been very busy, as you said, and how we're a huge hospital. We serve all age groups from little kids to elderly and everyone in between. We have inpatient services and outpatient services, and we're the largest behavioral health freestanding hospital in South Florida. We can be accessed picking up the phone, making an outpatient appointment. If you don't know what you need, they can help you on the phone. If you're in crisis, we have an intake and referral center that also serves as an emergency department just for behavioral health, which is very unique. And it's open 24/7 and staffed with psychiatrists, psychiatric nurses, social workers. So if you're in a crisis any time of the day or night, even on the weekend, you can come in and we will find out how we can help you.
If somebody's having a crisis, what is a simple phone number that they could call or go to? Tell us the number.
Okay, that's a good. I have it written down. Okay. I don't have it on the top of my head, but you can Google it. and
Okay.
it's right there. So the outpatient department is a good number.
Yeah, I can also tell you that you can call from a county perspective, you dial 211, and that's managed by the county, and they help facilitate anyone that's going through a crisis, whether it means that there needs to be intervention on the spot and have someone come out right to the home, or accessing services. So 211, like during hurricane season, you call 311, and when it's a medical emergency, it's 911. For mental health issues in South Florida, the number is 211.
And somebody, if they're like right on the edge, they can walk into a fire station, the police station, they can walk into a hospital, they can dial the suicide hotline, they can call. There's plenty of places to go. So they don't need, just put a pause on it, take a deep breath, and ask for some help. So let's talk about, recently there have been some Olympians that have come forth and said, I'm just a person. All right. And we see one of the most awarded Olympians, Simone Biles,
Yeah.
right?
Mhm.
And she said, I'm just a person. And I think there was another woman that went through a very similar thing.
The tennis player, Naomi Osaka,
Yes.
also.
Yes.
And that's this whole thing of the stress that we are all under. A lot of it is really unidentified as far as publicly, but we get that. And we know that people do certain things. There's people that drink a lot, eat a lot. Well, that wouldn't happen here, all right? Or people that do drugs to try to stay calmer, right? So you mentioned about the people, the residents of Dade County, they have access to Jackson, right? And they can go there, right? And one of the things that we recognize is that it is still a stigma. How comforted should these people be that people are not going to be there judging them?
Right. At the hospital, no one is going to be judging you. We're there to help. And we know that the community is suffering right now, and we see it in our hospital. Just with admissions, people who are actually sick enough with depression or other illnesses to have to be in the behavioral health hospital, we've had an increase of 22% since the pandemic. In terms of substance use disorders, people who have to be admitted for detox or substance use, we have 3 times as many as we did before the pandemic.
3 times as many drug and alcohol.
Correct. So you're saying people are trying to cope, but they're not necessarily coping in healthy ways.
Right.
But we got it. You're trying your best, and we'll help you if you come in.
So we were fortunate to interview some folks, and one was involved with the National Alliance for Mental Illness, and we had 3 different sessions. And then on the 3rd session, she brought her son in, who had had a schizophrenic break about 10 years before. And he came here and he had written a song, and he wrote the music and he sang it. He was sitting where you are, Flavia, and the mom was here. At one point, the mom and I were just crying,
Oh my God.
out of control. And I'm imagining him walking 10 years before on Biscayne Boulevard somewhere, hallucinating, no shoes, all right, and wondering about the future. And now he was fine. The song that he sang is "You Are Not Alone," which is like,
It's beautiful.
all right. And so we understand that people are feeling isolated, because even by virtue of wearing a mask, or people are afraid they're going to give it to each other, and that sense of isolation causes a big increase in admitting.
Absolutely. I mean, people get sad, and then they feel like they have no one to talk with, and that becomes a problem. I think people are more open to talking now with one another, and I think everybody knows someone who is having an issue. And it's important for us to, reach out to our friends and family members, just to ask them, "Are you okay?" And it's okay to not be okay, and
Right.
it's okay to
Excuse me.
if someone asks you, "Are you okay?" You don't have to say, "Yeah, I'm fine." Really, really, how are you?
And I think that's an important issue, is when we pass in the hallways and we mention something, and 5 seconds later we go, "Yeah, I'm okay." But the reality is that you're not, right? And how to have that conversation. A friend of mine who was suffering tremendously from AIDS, he calls me, he says, "Michael," he said, "this is the disease of loneliness." He says, "You go in the hospital, right? This is a year ago, you're alone. All right. You're at
Right.
home. You're wondering if you're giving that to
Yeah.
your family or the caregivers." So it is a lot of stress on people. Now, if we could we talk about the new Jackson West Hospital?
Absolutely.
What a great job. What a super facility. It really is tremendous, raising the profile once again, and in a dynamic city of Doral within Miami-Dade County. So tell us about that, and people that have contributed to that.
Sure. Well, we're so excited. It's the first time in 13 years that there's a new hospital in South Florida, and it's definitely the first one in the city of Doral. And we're very excited. The first baby in the city of Doral was just born a couple of days ago. It was a little girl. It's a new state-of-the-art 100-bed facility, really with the patient and family as the center focus for it. Anything that you could want in a new hospital, separately from it being an architecturally beautiful building. As you're driving on the Palmetto, you drive by it and you see it. Even just the kitchen, the cooking, it's culinary students that are there. So the experience is different. You won't get your typical hospital food, not to take away from what they serve in other locations. You know, the doctor to patient ratio is much smaller than it is at other hospitals. The components of telehealth, right? Because of COVID, and we were in the middle of building this during COVID, we found how important it was to have everything accessible to the patient inside the room. So you mentioned the disease of loneliness, right? So now we have the capabilities for patients to, video conference or FaceTime their families from within those rooms, right? They'll know who is walking into their room before they walk in. Everything is at their fingertips, at their disposal. The rooms are larger to when we can include more family, because right now we're still restricted with visitation policies. So really, we hope that this will just be a new source of great healthcare for a community that's had to travel quite a bit, in order to get their healthcare. It has an adult and a pediatric emergency room, which is great, full encompassing of all services in that facility. And if someone did need trauma, then they would be transported to Jackson Memorial Hospital and to Ryder. But pediatric and adult services and everything that you could find in this facility. So we're really, really happy that the voters of South Florida help approve the bond. So They're the number one people that really help support it. And then there's other individuals like the Milton family and the Jose Milton Foundation that really supported it. And the hospital within the Jackson West campus bears the name of Jose Milton. So we're really excited about that. And other partners such as Carnival Cruise Line stepped up to the plate, and the Miami Heat have stepped up to the plate, and Leon Medical Centers and various others that have really come forward to really help make this come to fruition.
There's no question that the Jackson health system, right, has risen tremendously, because when you get the city of Miami involved, when you get the county involved, right, and you get these private companies that want to be part of that, it really says we finally, after all these years, all right, have made a huge difference. In reference to the Jackson South 152nd Street, right off the US 1, the Miami Herald did a great video series.
They did.
Really great, all right? I get goosebumps thinking about it. And the way they did that, and profiling one of the physicians and the registered nurse, happens to be a guy, good field guys, right, to go into. And they talked about, and they showed it, about where the nurse was living in a different place, and whether he gave COVID to his wife and the suffering that was going on. And from what I recall, they started videoing that in March 2020.
Correct.
Right at the beginning.
Right at the very beginning.
The ability for them to recognize, right, and we're talking about everybody that was involved in that, to create history and an archive of what really went on here was really tremendous. And I urge people to watch it. It's really a great show. And as we look back in the years to come, oh, did that really happen? Right.
It's the truest account of what happened in that early time period.
And for us that live here and start recognizing the location, I know that place, I know this place, and it drove it home. So my hats off to Jackson, to the county, and to the Miami Herald for doing a great job. So if somebody winds up getting into the system here and they need mental health, they may get arrested, right? Which is not an uncommon thing. What happens to that person who's wandering and it gets a little violent? So tell us what happens with that.
Right. We actually do a lot of work with the police departments here in Miami. Recently, we had a pilot program where we had social workers in the call center, in the 911 call center, and trying to, be on the phone with the police as they're interacting with the people who are having problems in the environment, or with their families who don't know what to do with those individuals, and talking them through. And sometimes we can avoid a hospitalization, and sometimes we bring the person in and we assess them and we admit them and provide medication and therapy.
Several years ago, former Mayor Alex Pinellas was one of our speakers. And before, we decided on what to talk about, that subject came up about his family member being involved and, affected by mental illness. And we had, there was a full house at Casa Cuba I can't tell you how many people were crying listening to his story on how he said, there I was with enough power to get something done. And he said, correct me if I got it wrong, Mayor, I wish I could have done something more, right? And his brother killed himself with that. And he spoke publicly about the trauma that his brother was going through and his family and how it affects everybody, and you try to protect yourself. So lots of people don't quite know what to do with a family member that is ill or on drugs. In the old days, we worked with a fellow that was in rehab, and what they would do is they would have somebody that needed to get into drug rehab. They would call the police. The guy would go after the police. They would arrest him, and then he would get into therapy.
Right.
You're nodding your head. You're like, that's the way it worked.
Yeah, that's the way that it worked.
Right.
And I think most people still look at Jackson. I think the community at large is the place for behavioral health specifically, the place that you go to when you get Baker acted, right?
Yes.
And it's so much more than that. This facility is not, that is the place that you go where you get Baker acted for certain. But it's a full encompassing mental health facility. So it has the outpatient component, it has a bunch of other different components. And what Chris was saying about trying to work with the police department, that's a program that they want to expand, where social workers are brought in, particularly in the case of children in schools. Because what happens now, if a child is acting up or something happens, the police gets called, basically that child gets arrested, right? And it's very traumatic. So how to avoid that is by bringing a social worker into the mix of that, so that arrest doesn't have to happen. And that, you can advocate for that child, and that child get the right type of services that it needs without going through that traumatic experience of being arrested. So,
Yeah.
I was with a now county commissioner who said when he was arrested when he was a youngster, and he decided then, and he was found not guilty, and he won a bunch of money, right? He said he decided then he was going to become a lawyer. He took the money, paid for law school. And he said, Michael, I decided to become a prosecutor. A prosecutor? Why was that? He says, because I could, with just doing this, let that kid off that needed a break,
right.
instead of trying to defend them. And my hat's off to the commissioner for doing that. And so that's what you're trying to do, is intercede there, so you don't have to go through that process.
Correct.
Now, pretty soon there's a month, Mind Your Month. Tell us about that and the event that you're going to have occurring on October 10th.
Sure. So this was a little bit of a brainchild of mine that I thought of when I came to Jackson, and I thought, here's this wonderful facility that I don't think many people know of. How can we let the community know that it's there? And this was pre-pandemic. And then obviously the pandemic hit. And we knew, I think then, that we really needed to do something around mental health. And then unfortunately we had the Surfside building collapse. So then our community was affected in an even greater way from a mental health perspective. So it made just doing this event that much more important. So it's what you would consider a health fair event, right, that we would do, but you don't get your BMI, you don't get your blood pressure screening. It's just all about mental health and well-being. So there'll be speakers presenting from Jackson, from the University of Miami, from NAMI, as you mentioned before, from AARP, from different organizations on topics, everything related to mental health, things like stress and anxiety, to things a little bit more complicated, like, mood disorders and things of that nature. Topics such as, how can kids cope with social media? We've seen a lot of issues around that and how that affects children and their mental health. But we want to balance all of that in an event that's also enjoyable and not heavy, right? Because who wants to come to an event where that's all that they're going to hear about? So we want to have a nutrition section that talks about, what are the great foods that boost your, good mental health? What are the type of physical activities, yoga, meditation, walking, some mindfulness activities, some music. So it really is a full day of activity that the whole family can come out to for free and really learn about not only the resources at Jackson Behavioral Health, but the resources available throughout the entire community around mental health and how they can access them.
And where's that event going to be held?
Margaret Pace Park on Biscayne. Yeah. So very local.
All right. Good. And you mentioned about foods that can boost your mental health. Why don't you tell us about some of those foods that are good? And conversely, sometimes say these won't help you, right? That's
right.
probably more important,
Sure.
right, to eliminate some of that stuff. So tell us about some foods and drinks that should be avoided, and maybe some that you should do some extras of.
I think, the most important thing is having a balanced diet, right? And you want, your leafy greens and, your vegetables to get your vitamins. Also protein. You definitely want that, and carbs, just in a balance. What you don't want to do is a lot of late night snacking, a lot of carbs that bring your sugar up really quickly and then down just as quickly. And then, of course, you're talking about the drinks. The alcohol has become, kind of a big problem for people out there, especially people now working from home. The day doesn't really have structure to it. It's 5 o'clock somewhere all the time now. So to really put a limit on that.
So, and with some people working from home and a lot of people doing a video conferencing, there's a lot of people that miss that office family. You'd go to the water fountain or the lunchroom and you could complain about everybody and feel really good and then go home. So a lot of that has disappeared. And we've seen on both sides that people that are not here, they're working from their homes, and then people still at the office, they miss that. It's sort of a death of sorts in that sense. Well, what happened? The people that we would see every day, looking forward to do it and going out to lunch with them occasionally, that's gone. And a lot of that can add to stress.
Absolutely. And that's why I think a lot of people now who originally wanted to work at home find themselves wanting to go back into the office, or at least doing a hybrid model. And we do that with some of our staff at the hospital.
And I was talking to one of our computer guys, and I said, I got your check. And he said, okay, great, thanks. I called him. I said, listen, I need you to do some work. Okay. Calls me a week later, and he goes, what happened to the check? I said, it's sitting at the front desk. He said, no, I do all the computer work, online. I said, oh, I forgot. So I really wanted to see him. I really wanted to talk to him, not about the computer work. I wanted to be able to look face to face and have that conversation. So now it's just this, and he's been doing our work for decades, and actually his family's been doing it. And so I miss that, right? And I think a lot of people miss that. And so let's again talk about if somebody is struggling, all right, what are some of the things that they should look at and be able to ask themselves, where are you at in the scale of things?
Right. So, I mean, you have to really reflect. And if your anxiety or depression or your sense of loneliness is interfering with your functioning, it's time to get help, to talk to somebody, a professional.
And how do we move from the stigma and being uncomfortable talking about it to somebody to being okay? You don't have to be great, but being okay to say, here's what I'm dealing with. You've been around for a long time, so why don't you tell us, Flavia?
I think the more awareness we can bring to the issue. I mean, I think you mentioned earlier some of the athletes bringing awareness to it. A lot of movements tend to start via sports because it's something that everyone can relate to. I think the more of that we can do, I think the more events that we could do like this, that, the more open the conversation is. And what Chris said earlier about the pandemic, the one good thing, maybe there are a few other good things, but the one that I've noticed is definitely people speaking about this a little bit more freely. And even this, new generation of kids. I have 2 college kids, graduates during this time, that haven't experienced working in an office because since they've graduated, the jobs that they've gotten are remote, right? And they're really yearning for that sense of kind of, camaraderie that they haven't seen. So we'll still have to deal with that even because the whole landscape of how we work is now going to change. So the more conversations we can have about this, and I always say, I think that, the generation that's coming after me is a little bit more aware of themselves and their feelings and things like that. And I think that's going to help definitely remove the stigma, but we just need to continue to bring it to the forefront and have the conversations.
And one of the things that we've certainly learned during this time is try to keep politics out of it. Talk about how you're feeling about what's going on and how your wife, spouse, your family is dealing with it. We know lots of children are behind, all right? And I'm not quite sure what the solution is, all right? There may be a couple of years in there that's just going to be behind or skipped, or that the parents are going to have to hire tutors and be able to walk these kids through there. We were talking with one of the presidents of one of the local colleges, and his words were, listen, you will get to experience college life soon enough, all right? Don't worry, you'll be there, and maybe next year you'll have a regular graduation, and maybe next year you can live on campus. This is a year ago.
Sure.
And I think that's what we want for our children, to be able to have that college experience, because the college experience from an apartment on a computer certainly isn't what we wanted.
Correct.
So again, here we are, almost October 2021. If we're lucky, we're near the end of this, if we're lucky.
Hopefully.
But still, lots of people are still getting sick. We know that hospitalizations are way down right now. That's one of the things we look at. Forget all the news. What's going on in the hospitals,
Correct.
right? And I think that's an important issue, for us. One of the things that I wonder about all the time, healthcare providers are working in hospitals, specifically working with COVID patients. The percentage of healthcare providers that have not taken the vaccine is disrupting my brain, right? But put that aside, the people that are doing that really have a lot of courage, and they're really committed to taking care of people. So what is that like, working with patients and other staff on a daily basis that are being exposed to COVID, and they know that every day?
It's not easy. I mean, like you said, this has been going on for 1.5 years now, and we keep thinking it's going to be over, and then it never is. But we have peaks and troughs. So sometimes we're in a good way, and the COVID cases are down. Right now, they're going down. Right? We had the big surge with the Delta. Now it's going down. So you can almost hear a little sigh of relief around the hospital. In behavioral health, one of the advantages we have at Jackson Behavioral is such a big place that we have specialty units for our patients, which is unlike other psychiatric units around the area. So we have actually a unit where we can have COVID positive patients separated from everyone else. We're down to one person on that unit. So we're very, optimistic about that, but we keep it there. But the staff, we've been really doing a lot for our staff to help them be resilient. Flavia before mentioned meditation and mindfulness, yoga. Early on, we had an app developed for our staff that they have on their phone, and we had a local organization, Warrior Flow, videotape meditation videos, yoga videos for the app, so our staff could access that anytime. Really quick things that they could do in 5 minutes on their break to kind of decompress and get into a better headspace.
And when we look as outsiders, at least looking at them, they walk in and say there's 10 patients or 50 or 20. That's the stress on them and their families certainly is a lot, and for a long period of time, right? It's almost a war zone in the sense of when you look at the trauma that's occurring, and when you're in the hospital, right, you're sick. And we know some of the IC units are still pretty active there. And my hat's off to the healthcare providers, whether they're from the janitor, the food server, the administrators, all the way to the nurses and the doctors who say, this is what we do. Right. I mean, it's just so hard to comprehend that, because we have a choice whether to go do that. The closest I could get to this, in 20 years ago, I was training for the Marine Corps Marathon. 9/11 came. The Marine Corps Marathon was in October. I said, if I don't go, they won. We made sure our wells were up to date. Everything was there. I said, I can't let that happen to my psyche, that I'm not going to go do that because I'm afraid of whatever it was. So I'm sure that's the sentiment of a lot of these healthcare providers. So my hat's off to, again, the administrators and the healthcare providers, all the county, especially at Jackson. So my hat's off to you. And we're going to wrap up with, if we could, tell us how the foundation promotes the Jackson, the things that you do to help raise money, and how it gets allocated to the different facilities.
Sure. So it really is all dependent on an individual and a donor, right? So we have individuals that may donate $5 a month, and they decide that they want that to go to the Children's Hospital. And that'll help fund programs like Child Life Services, right? Which ensures that there's toys, that there's activities, that there's someone to be with the children, which has really, really been challenging during this period, where there's been one parent allowed in and they can't leave and they need to take a break. So Child Life has been able to help. So there's definitely those aspects of it. And then there's those donors, like I mentioned, like the Milton family and Carnival Cruise Lines, that come in at the highest levels and help support the building of a brand new hospital, right? So the foundation really helps support everything in between. From a mental health perspective, can we have an art therapy program for children that wasn't part of the overall budget? Can we create at the rehab hospital a new gym, right, that can be used by patients? The aquatic center, how can we enhance that? So it's really anything that you think of within the healthcare system that isn't the nuts and bolts that's covered by a regular operating budget is where philanthropic dollars come into play. And we're happy to be able to do that. We do that through special events like this one to raise money, this one specifically for mental health. We do it through an annual gala that we do that helps raise, a few $1 million overall.
When is that?
The gala's in January 29th, and that'll actually be at the new hospital at Jackson West. So we're really excited. We'll be able to use it as a showpiece in January. We certainly hope the COVID numbers are still down by then. If not, we'll have to figure out what we do at that particular point. So different events like that. We do a children's luncheon in November with the Guardian Angels to help raise money for Holtz Children's Hospital and everything in between. So really our role is just to try to augment. And I like what you said about how much Jackson has changed in the last 10 years. That has definitely been as a result, I think, of the leadership at the organization and Carlos Magoya, who is great when you have a banker and a business-minded person that comes in and turns things around. And part of that has really been shifting also some of the focus to philanthropic support that may not have been there previously. So
small contributors can send a check to the Jackson Health Foundation, all right, and put on it what you wanted to go to.
Absolutely.
If somebody wanted to give money specifically to the behavioral health,
that would be
right?
great.
And how would they do that?
They can either go to our website, which is jacksonhealthfoundation.org, and they can click on donate. And when they click on donate, there's a drop-down menu, and mental health or behavioral health is one of the options that they can select. They can call 305-585-GIVE, and someone will answer at the office, and they can make their donation that way. So there's a couple of different ways that they can certainly do that.
Good. So mind your health, all right, is important to all of us. And one of the things we certainly learned is how to navigate during this time. And I'm glad you guys are there, making a huge difference to our community. And again, congratulations to everybody at Jackson Memorial Hospital System on doing a great job. I would like you to talk to somebody that might be stressing right now. And which camera should we look at over there? Oh, the center one. Talk directly to them, all right, and help them out.
All right. So a lot of people are stressing out right now. You are not alone. So take comfort in that. Also, stress it's time limited. It's not going to be here forever. So definitely get some help. Talk to someone. Come in. Something I didn't mention yet is telepsychiatry. You can get therapy now on the phone or on the iPad. So it's really in the comfort of your own home. Nobody even has to know about it. Do this for yourself and for your family, and you're going to get through it. This is not going to last forever.
Great. Thank you, Chris. Thank you, Flavia. Again, folks, thank you for joining us. If you need more information about the Jackson's health system that includes everything that they do, feel free to go to Jackson Memorial Hospital and look it up online and find out all the things. You can find out about the behavioral health and also about the foundation. Thank you for doing what you do.
Thank you.
Thank you.
Michael Fernandez, thank you for your help. And who is that over there? Is that Andres? Thank you for this. And where's the camera? Which camera are we looking at? We're looking right over there. Again, thanks for your time. Be safe out there. And again, if you need help, walk into the fire station, police station, a hospital, dial 211. There's lots of help out there. And as Chris was saying, it's not going to last forever, and you will get better. Thanks again. Have a good day.